Okay, you'll take questions. Thank you very much. Sis Nkosazana, if there's one or two words you want to say after the questions. Okay. You realize, colleagues, that in the main, the colleagues that we wanted to speak to us are the ones that were responsible for the soldiers and the police that were deployed by the president, and also the colleague who's responsible for the border management, and also the colleague who's responsible for transport, of course, and also the colleague responsible for the places where we buy food and where also we needed to shut down some economic activity. So those colleagues have now spoken. We will now take questions from yourselves, so that, and again, as we take questions, colleagues have said, we are on day one, and as everything else, on any day one of the start of any campaign, there might be some difficulties, and colleagues have spoken to those difficulties, they've been open to those difficulties. But having said that, let's take the hands, Sisi, Mfo, the gentleman that side, the lady, the two ladies. That will be our first round. Are there any people in Cape Town that we should be giving an opportunity? Oh, we're not in Cape Town. Oh, thank you very much. We can start, colleague. We want to hear you.
Criselda Lewis from SABC Television News. My first question is to Minister Patel. Minister, at what point do you become tougher with the retailers? I know that it is day one, but it seems that most of the challenges that were had in terms of social distancing in areas identified as problematic pertained to retailers, and perhaps retailers themselves, again, not in terms of ensuring that there is between those who are coming to buy at those particular retailers. The fact that you are ministers responsible for the ensuring that there's no further spread of the coronavirus in South Africa. I've heard of news that ACDP leader Kenneth Mishwe has tested positive for the coronavirus. We know the issue relating to how with the president at a meeting that they had. Would you suggest that the president perhaps go for retesting, given that he already has, and we only get the results of the ACDP leader now? And thank you.
Okay, next.
Good evening. I have two questions quickly. Minister of Police, General Tele. My name is Aser from Capital Life, by the way. Can you maybe give us an indication, where do you keep these people that are arrested during this period? Then question number two, I just want to ask, there is a problem in townships. Seeing long queues, especially in complexes, shopping malls, because most shops are closed. Is it true that the announcement that all shops must close? Thank you.
Thank you. Next. Just a minute. Can we have a better mic? That mic seems to be on and off.
Ms. Bula from ET. Minister, there seems to be a culture of arrogance and ignorance by most residents who we spoke to today, saying that if they don't find whatever basic essential needs, such as bread, meat, whatever it could be, they will be lining up again and going to the shops, and they don't care if this virus actually is out there and is deadly. Could we be seeing harsher restrictions in terms of increasing the numbers of law enforcement authorities on the streets to actually keep people away from such behavior? And then two as well, the homeless people are actually saying that they don't know anything in terms of communication and what's going on. In fact, they claim that when they go to some of these suggested houses where they can find safety and get better food, they're being chased away and turned away. What's going to happen in terms of that problem that we have right there, because they're quite vulnerable and they're in the streets knowing nothing? Thank you.
I want us to deal with your last question. We will have colleagues tomorrow that will be from the social cluster who will be able to answer that question, if you don't mind. Because these colleagues from the JCPS might not be having the necessary detail in answering that question of our people who live in the streets. Thank you very much. Next.
Thank you so much. Sidi Madia from News 24. Two quick questions. I think both the Transport Minister and the Police Minister spoke about the N1 highway. Can I ask about the alternative routes? You know, a lot of people saying, but if they're on the N1, what happens to the R101? If they are looking at the N4, what about Tabazimbi? Are you also deploying forces on the alternative routes? Because if you turn people around, they just go to another one to still get out of particular provinces. Secondly, it's linked to what my colleague Criselda asked. Reverend Kenneth Mesher testing positive. He wasn't just next to the president, he was also next to the deputy president. Has Deputy President Mabuza been tested? Is he okay? Is he in self-isolation? Thanks.
Was that the last question? Thank you. Oh, there.
Thank you. Al-Nashid, Spotlight News. Minister Patel, just on a particular point, you spoke around equipment, and previously you've spoken briefly on ventilators. Could you speak a little bit more, give us more details about what's happening in the sector in case there is a shortage? Thank you.
Okay.
Hi, good evening. Isabel from Network 24. My question is for Minister Sele. We received some photos, videos, especially from the Cape, about the police being a bit more enforctive than normal. If you can just comment on that. We don't know if it's fake news or what's happening there.
I don't know whether he has heard you, but can you repeat yourself if you don't mind, please?
Is it better now? Okay.
Yeah.
My question was regarding to the police and also the armed forces using more force than necessary to arrest people or get them off the streets. We received videos of people being hit or kicked even. So I just wanted to find out what is happening there.
Okay. I hope you have been heard. Next.
Good evening, colleagues. My name is Morris Msiza. I'm from Soshanguve Community Radio. My question actually goes to the Minister of Police and Mr. Patel. We have, in Soshanguve today, we experienced a number of people queuing in malls, and that was a bit, frustrating for us. And there's other videos that we have seen in Hammanskraal. I don't know if the minister has seen, where people are in a party giving false information that they don't care about this thing and so forth. Is there anything that the minister intends to do for such people? And to Mr. Patel, how do we then address the issue of the people that are queuing up in malls? Because if we allow then people to say, okay, we can have more than 200 people queuing up in mall, like the situation that was happening at the Soshanguve crossing today, self-isolation is not considered. So why do we then have a lockdown if we will allow people to queue like that? Can I please get an answer on that? Thank you.
Thank you very much. Colleagues, who wants to start? Okay. Patel?
Thank you very much. There's been a few questions, so I'm going to try to group the questions that were asked. The first question relates to what happened at retailers today. Questions asked by a number of the media houses. So I think I want to reinforce the message that we gave earlier, that today was the first day of the lockdown. We've looked very carefully at the experience. We've listened to consumers, to the police. We've had valuable feedback from Minister Cele and the police. We've spoken to all the major retailers. We've had feedback from small spaza shops. And we will now be refining the measures in place to ensure greater social distance inside the supermarkets, but critically outside the supermarkets too. There are a number of measures being looked at. For example, in some of the retailers, they will now be providing trolleys to those in the queue so that there is at least a distance between people constituted by the trolley. We will be refining with Minister Cele and the Command Council additional measures to enable us to have fewer people in the queues and gathering in places where, in fact, the virus can spread. We have to do things to ensure that we limit the spread of the virus. We don't want to introduce measures only when very large numbers of people have died. These measures are to enable us to reduce the spread of the virus and to reduce the number of South Africans and residents who are in South Africa from dying. So these are now being evaluated, and as soon as we've made these decisions, we'll make the announcements. Already today, we've had a discussion, as I've indicated, with the major retailers. They are absolutely aware of government's concerns on these, and as I say, we will be taking the necessary action. The second question that came up is on spaza shops. The regulations specifically enable spaza shops to sell essential goods, only the essential goods in the regulations. Spaza shops also have to ensure social distance. They're tiny little shops, and so you can't have numbers of people gathering there. So those owners also have to take steps to ensure social distance. The spaza shop regulations apply to all spaza shops, irrespective of who owns the spaza shops. So spaza shops can remain open, provided they only sell the goods on the essential goods list that has been gazetted. The question came up about misunderstandings of what the regulations are, people being ignorant of the regulations, and people not taking it seriously enough. I want to underline an important message that has come from the President, come from the Minister of Health, come from the Minister of Kokta, and come from Minister Mthembu. We're in an absolutely serious crisis that we have to contain. And so all of us have to work together to get the message out. Yes, government has an important role to speed up the communication, to use even more platforms to reach out people. so too have the media, is to get the basic message across. We cannot afford to have a debate about the smaller issues and lose the basic message that we have to stay at home, we have to take measures to ensure that there's food supplies to South Africans and to everybody who live in the country. That's absolutely essential, that we use our combined power as government, as the media, and the many people on social media also, ordinary residents and citizens who must spread the message and show that those countries that were too flexible, that were too easy, are now paying a massive price with huge numbers of people dying in those countries. The next question that came up was the big queues in the malls. I've covered the shopping, the supermarkets and so on. We've taken into account that today was the first day that many people who are paid on a monthly basis could go to the shops. But even so, even though next week we're going to have a large number of people who will get social grants, it is vital that we have controls in place to limit the spread of this virus. And so we're going to be working hard to ensure that those measures are in place, that people are able to access food, but that it's not large crowds that are there at any given point. I've also been asked a question on medical equipment, making sure that medical equipment is available, and there's a number of things that we are doing now. I indicated that there are key products that we will no longer allow for export without a particular license. This will make sure that we have significant South African stocks available, that we also make stocks available to neighboring countries. We're in this together. We need to make sure that we all come out on the other side together. But there are other things that we're doing. As I indicated, we're working on a prototype of a ventilator that can be built here. We're using the technology that previously have been used to build cars and to build components for vehicles. These are now being repurposed to see if we can get this basic ventilator in production as quickly as possible. We're fast-tracking imports wherever we can find ventilators. I'm using that as an example. We will make sure that the clearance at the ports of entry are facilitated and fast-tracked so that the hospitals and the National Department of Health and provinces have the equipment, that they don't sit stuck in the ports themselves. We are working with clinicians to ensure that all the work we're doing is consistent with the basic healthcare protocols, and we're also ensuring that we use all of our facilities more efficiently. Before the national state of disaster was declared, every hospital could only use its ventilators for its own patients. Some hospitals had a higher supply of ventilators, others had very little. Through an amendment or an exemption that we've granted in the Competition Act, hospitals are now allowed to share all of these kind of facilities between themselves and to share patients, to share nurses, to share the kind of skilled technicians and medical personnel that operate the various equipment. Ventilators is one clear example, but there are others also. So these are all measures we're taking to ensure that we use what we have as effectively as possible, that we build more of what we need, we produce more of what we need, and we import as much as we can find elsewhere in the world. And so obviously, under difficult circumstances, we have to use every tool that's in the legal toolkit to ensure that we bring the necessary medical equipment to be available to our people. I think those covers the questions that have been asked from me. Thank you.
Thank you, Minister. We now call on Parks Minister Mbalula.
Well, there is one question, and I think everybody is happy with what we explained, which is that the the big challenge on the ground currently on the first day is transport in relation to the regulations. And I've explained that, echoing the view of my colleagues and South Africans of goodwill, in majority, who say that we all have got to obey and follow the regulations. It is a big challenge for the taxi industry to ferry 60% people, but it is also a big challenge already in terms of the lockdown, because it affects taxi industry heavily in terms of their own profits and so on. And that is why in our presentation we have addressed the situation of how we are going to intervene. And I want to salute the taxi industry leadership for acknowledging this and coming to the party, understanding that this is our cause as South Africans and the world over, to converge and work together in pushing back the scourge of this virus. So I know the complaints, they are there, about the fact that we are hard hit if the numbers are going down per taxi or minibus, but we insist on these regulations because social distance must be realized in a minibus taxi and also in a bus if it is taking people to work. That must happen. Unfortunately, we've got to work within those confines. The culture of arrogance and the culture of ignorance, I don't think it is ignorance when somebody posts on social media and boasts to thinking that is challenging the state. This is not a state issue. It's a question of humanity being attacked by a virus, which need us as a people to unite. Now, we can't allow a coterie of few people to outweigh the majority who embrace goodwill. Even where police have acted with the strictest, stamping the authority and the soldiers, South Africans have embraced those actions because they say, no, this cannot go on. We know that people have been saying in the townships, these queues cannot go on. But we need to understand that it is not just the law, but it is equally the people themselves acknowledging the fact that we are in this together. It's not like President Ramaphosa decided on a state of emergency where in 1986 and Pegicele is Adrian Flock. No. We are in a democracy. And therefore, in a democracy, we are faced with a big challenge that here is a virus. And how do we fight it? It is a pity that you can have people in an era of peace who think that they want to take up arms and fight the state. There is no time for fighting. It is time to work for goodwill and win this together. And we know that this virus, we are told by our own people, health and the Minister of Health, we can only win it by social distance. We can only win it by not gathering en masse. Who would have known that in South Africa today, in the next coming days, we'll not go in for Easter and all of that. We have accepted that. It's painful, but humanity have said, let us converge and work together and fight. The operational plan in terms of alternative routes, obviously, those will have to be found. I mean, those who use alternative routes, the traffic and working with the police and everybody will deal with that. And to ensure that we push back the numbers. And those who want to undermine the rules and still go long distance and do all sorts of things and block, bait, breach and so on, we'll have to push them back. They must stay where they are. And that is what needs to be done. And I want to pause there and say that there are challenges in day one in terms of transport, but there is goodwill in the sense that the majority of taxi people have come to the party, and we still want to make a call to them, Minister Mthembu and colleagues, that please transport people between 5 a.m. and 5 a.m. up to 9 a.m. The question has been asked to me and Mr. Mthembu by everybody, including in social media and everywhere. What happens with people between 9 a.m. and 4 o'clock? We would have used minibus taxis to go for grocery and all of that. We want to discourage people for using taxis to go a distance to get grocery. Can I repeat that again? We want to discourage people from getting into a minibus taxi at 9 a.m. to go to town, a distance, to get grocery, to go back home. We are encouraging in this time, let's get whatever that we can get, which is food, in our neighborhood, where we can walk a distance and do that. Where we have to get into a taxi, it should be under exceptional circumstances. That I stay in Zingi, and therefore there is nothing in Zingi. I then have to use a taxi to get something in Mukupad. Then in that instance, that is acceptable. But if I stay in my vicinity, there is a spaza shop, there is a supermarket, don't move and go to Zingi and find what you want. You will get it after 21 days, where we will have, some freedom to move. It does not mean we will have won, but we want to contain this. We are discouraging people from doing that. That is why we are giving transport in the regulations limited time to only ferry workers for essential services. Now, we can't review that now. If we were to review that, like Minister Patel says, it means on Sunday when the Command Council meet, we'll have to examine, is this arrangement that we have introduced as transport constraining our people? Is it helping the containment, or can we review it? At the present moment, in day one, we can't, because we are not in a state of emergency and apartheid. This is above board. We don't want people to travel and to gather en masse. Get what you want, milk, bread, where you are. Akosia Inyova, there is no go area here where it will be said that you cannot bring in food into the township, you cannot bring a bakery into the township. All of those deliveries are happening. So you can get milk, you can get eggs, you can get whatever you want. So our luxuries, we reserve them for later. So I'm just addressing this point because it is a huge issue for those who are commuting with taxis and who are using taxis to get shopping and all of that for food and groceries. They've been asking that question, and my answer to them is that limit the movement. Stay where you are, and then don't go far away to get what you can actually get in your neighborhood, what you can get in a spaza shop. Thank you very much.
Minister Mbalo. Thank you. Minister Nosiviwe Mapisa Nagula. No question for you, okay. Minister Pege,
Thanks, Madam Timbo. Where are the people that we have arrested? We have kept them, we will keep others. I did give the numbers, which provinces are they arrested. Every province in this country has got a police cell. So they're in the police cell except one, that is in the correctional service center. But the rest are in the different provinces in different cells. What we try to do is to do what we're supposed to do. Sanitize them, give them the stuff that is supposed for phone and other stuff that they don't begin to spread the disease if they have. As a South African police, we have ordered quite a big number of this temperature thing is coming, but for now we work with health where we can't provide to help us on that. So they're on the different provinces. They're there. I'm sure we're not asking the question because we want to see them. It is on the regulations that you can't visit our cells at the present moment. They are restricted. Nobody can visit. If you want to send them a half brown, wait, the time will come. So there is a question. I don't think I understood it very well. Do you want them to use more force? Were you saying you want police? Are you asking me if I want police to use more force, or are you saying under prevailing circumstances are they using more force? You believe they are using the more force? Wait until you see the more force. They are not. They are really being very kind. Even these 55 people will tell you that they were arrested under normal arrest conditions and all that. Here, maybe with the question from Soshanguve, I've got 33 incidents that were reported last night of this form of people that are misbehaving. Let me tell you one thing. South Africans are very irritated by those people. Are very irritated by these misbehaving people. Otherwise, they would not be phoning us the rest of the night, first thing in the morning, that so and so, they report about Mawoti, they report about Tembisa, they report about all this. We do have the list of those places. And I can promise them, it won't be without returns. Those people that are reported and continue to do that, break the law, it won't be without returns. We are not going to undermine the goodwill of the people of South Africa that give information, and we don't act on that information. We will act within the law, but we'll have to be decisive. Decisiveness is measured and measurable. One question that was asked, did these people use bypass of our roadblocks? Gauteng is the most difficult of these provinces to roadblock. It's got too many ends. Is your N1, is your N3, is your N4, is your N8, is your N14, around there, some ends and ends and ends. Maybe that's why in Gauteng alone, we had 23 roadblocks last night. Gauteng alone, we had 23 roadblocks, including the parallel roads. Most of the N are paralleled by the old roads. Your R101, your R102, your R103. So all those parallel roads that if it is not N1 is parallel R101, they were all taken care of yesterday. Hence we had 23. It didn't matter which direction you took. If that road, either primary road or secondary road, was leading out of Gauteng, we were there. And then we make sure that we took care of those people that they thought they would bypass us. I want to repeat that there were 172 of these roadblocks in the country. Durban is easy. There are just two ends. Is your N3, your N2. You see Durban, your M4 South, your M4 North, your M27 Chatsworth, your other M25 Kwamashu. Durban is sealed, so it's fine. So there you need about five to seven to seal Durban. But in Durban too, we had 22 roadblocks. Cape Town 2 is easy. It's got N1, it's got N2, it's got M7 going to Namibia. So you see those, you're done with some few M's. So nobody yesterday could have moving during the time, could not meet any form of roadblock in the Republic of South Africa, especially these three big centers. And we will be increasing on that. We will be making sure that all the time we are there until the 21 days are over. I want to reiterate, Soshanguve, to say we saw that and we were told it was not only Soshanguve with this long list. I think the worst of them, by the way, was not Alex. I think it was Lenasia at Boxer Shop. I think that was the worst one. So we are monitoring them. We are working on them. That will have to change. Andrew Flock, I think, led my torture, is one man that tortured me worst. Under him, I was worst tortured, and I would not love to be like him. Thank you.
Minister Mzoredi, was there a question? There was no question. Okay. It looks like we have concluded the question, unless if we can give you another round, but that will be the last round. Vuyo, the lady and the gentleman, and the gentleman and the lady. Thank you very much, Vuyo. We sanitize it. Yes. Oh, okay. Now we'll answer them. Continue.
To the Minister of Defense and the police, have you received several reports of undefined behavior from the part of some of your members? Also, some Southerners complain that some of them aren't wearing masks. To the Minister of Transport, why were Cape and Kinshasa allowed to operate after the lockdown kicked in? And second question, apparently there are two cruise liners outside there.
Do you know, if so, do you know if they have any passengers on board?
Thank you. Next.
Antoinette Slobert from Rapport. Mr. Mtim, I know the Minister is not here tonight, but surely as a command council you must have been briefed. Can you give us an understanding of the profile of the people who are infected at the moment? What it was at the beginning, how it has changed, and how you expect it to change going forward?
Okay. Next.
Right, thank you. My name is Pelane Pachadi. I'm from Newsroom Africa. I just wanted to check, as far as communications is concerned, we've seen a number of people here going to I'd say the rurals or other provinces from Gauteng. Are local government officials and councillors as well being engaged as to assist as far as communications concerned about this particular virus, so that people will be able to stay indoors? You'd know that in villages, people love to gather in their numbers. So if people have gone home in so much of their numbers, perhaps they'd want to also gather. Those are some of the places. My assumption is that you'd want to go and check with. And the second one would be the companies forcing people to go to work, and also hearing claims that some of the companies also released letters saying that if people don't come to work, then they will be fired come the end of the 21-day lockdown. Are you concerned, Minister Patel, that these kind of companies, when you realize, if such of cases are brought to your attention, that it would not really mean going to consult a lot, but you need to deal decisively so that people are able to know that I still have a job come the end of the 21-day cycle? Thank you.
Yes, well.
Minister Crisaldo from SABC Television News once again. Just some clarity on the two people who died. I know that there's an issue with one of the individuals. Could you confirm at all at this stage if one of the two women that died is confirmed not to have had COVID-19? And the second issue, do you know anything about an incident in Kenya where it's believed or alleged that a South African committed suicide after finding out that they may have contracted the virus? Thank you.
Yes, ma'am.
Good day, everyone. My name is Johnny Sai. I'm with African News Agency in Pretoria. My first question for Minister Lamola, please. Sir, could you give us an insight into the court cases you have faced from people who are opposed to this scenario that is declared now? Are there people who are taking you to court for this declaration? And secondly, to Minister Dlamini Zuma, my question, could you give us a bite on the preparedness of the provinces, ma'am, and the smaller regions? How prepared are they as well to deal with this eventuality? Thank you so much, ma'am. Thank you.
Thank you very much. The next colleague.
Hi, Simile from the Sunday Times. Just for Minister Patel, can you give sort of a ballpark estimate of what percentage of the economy is currently not functioning due to the lockdown? Thank you very much.
Thank you. I thought that could we have been a football. By the way, all of us on matters of health, we also get advised by professionals. Similarly, on the question that was asked on the president and the deputy president, they have health advisors that work with them from time to time. They will also be advised by their advisors, including, by the way, by the Minister of Health himself, if indeed there is a need to approach this matter in the manner that you are proposing it is approached. So we will leave it then to the deputy president and to advisors and also to the president's advisors. That will include our own Minister of Health on how the president, if need be, needs to deal with the developments around this matter. Colleagues, let's then answer the questions. Who wants to start? Want to start, Martin? Aaron? Or want to finish?
If they are not ready, I can start. At Cape Town International Airport, yesterday, there were 3 outbound flights destined for Frankfurt, Germany, Zurich, and Switzerland, and Munich in Germany. And unfortunately, there were 120 people who could not find seats on any of these flights. The German consulate was at the airport and they provided consular support to their nationals. And by the way, Germany has been very, very cooperative, working with us throughout, and like many other countries, there's no country that has acted in a manner that is not consistent with the protocols that govern us in terms of interaction on matters like this. And they are going out of the country and not coming back. And so, in terms of that, in terms of the 21 days of the lockdown, these airlines are not allowed to come back to South Africa for that particular period. So the NOTAM, which is a notice to all airlines and countries, has been done. It's not the only incident. There were South Africans who were stranded in Qatar last night, and the ambassador was negotiating with us that Qatar Airways want to bring them in, and so on. It's a matter that we're dealing with last night. and they said they got the message about the lockdown whilst they were en route to South Africa. And then we explained that this message was declared 72 hours for everybody. It meant that if you wanted to come back home, wherever you are, in that 72 hours, you are supposed to come back. So what we're doing last night was to clear. Everybody was already in the country, but going out. Now you can check the airports. There should be exceptional circumstances. If any airline, private or whatever, that it could land in South Africa within the 21 days that are declared a lockdown. And we have said that the only people who can land, it is the cargo airlines, also with essential service. Now, they've been complaining also to say that our regulations must be amended to include not only essential service, but cargo in general. Now, it's a matter that we've been attending to and will report to the Command Council. It's not a big issue. And then secondly, there were similarly 30 British nationals who could not find seats on outbound flights and were provided with consular support, and arrangements were made for them to leave to go back to the United Kingdom. The other point about South Africans on the ship, I can tell you now that there are 6 South African seafarers on a cruise ship called Queen Elizabeth II, currently at anchor in Durban. The South Africans there want to disembark and return home. Okay? 6 South African seafarers in the ship called Queen Elizabeth II. Now, these South Africans want to return home and want to disembark. However, our regulations do not allow crew changes. Remember, we explained that. In the lockdown, no more crew changes. No more crew changes at any of our ports, even if these are South Africans. And the Queen Elizabeth II is waiting for clearance to enter the port in order to refuel and take provisions. It's not there to dock and offload, but our seafarers on that want to come back home. So if we are to do anything, it must be informed by the rules. I mean by the regulations that we have passed for the lockdown. We said that crews will not be allowed to actually disembark. We are attending to that matter as we speak in relation to these South Africans who are on board of that ship. If anything were to happen in terms of the regulations and what is permissible, is that those South Africans, because they've got a constitutional right to their country, they are already here and all of that, they will then have to be quarantined for a period of time, like we have done with those who landed from China, school students who are somewhere in Guruleni and all of that. They've been quarantined for some time because they also come from these risk countries. So the Queen Elizabeth people, if anything were to be done that is permissible, it means that we'll have to quarantine them for a number of days that are stipulated by the regulations guided by the Department of Health in South Africa. So there are many of such cases, and like I said to you already, on Tuesday, governments have approached us. They want to do what we call health evacuation of their citizens. So since the lockdown, so next week Tuesday, the Germans government have actually come to us. They want to evacuate their citizens. So that is exceptional circumstance where somebody has been in the country, there is a lockdown, they negotiate with us and they want to be evacuated to go back home. So those are the cases that we consider on the lockdown. But overall, there is no flight that comes in. Go to OR Tambo, Kinshasa, go to Cape Town, it's a lockdown. And even domestic travel, in terms of air service, it's a lockdown. There is no travel at all. Thank you very much, Minister.
Right, that was Transport Minister Fikile Mbalula, and that was several of the ministers involved in South Africa's response talking about day one of the lockdown. If you missed that press conference earlier, a finality on the number of cases in South Africa, 1,170 cases of COVID-19 now known in the country. And then some confusion because earlier the Health Ministry said that 2 deaths had been reported. Those 2 women had died this morning of COVID-19. Now, Minister in the Presidency, Jackson Mthembu, saying that 1 is only a suspected COVID-19 case. So as it stands, South Africa has 1 death from COVID-19 and 1 suspected. That was not clarified by the Health Minister himself. He was speaking to the World Health Organization. Just some other major issues coming up today: shopping and buying groceries, because in some areas in South Africa we saw massive queues, people standing very close together. Becky Cele, the police minister, saying that they were looking for an answer, and Economic Development Minister also Abraham Patel saying that they are talking about that, and ways have to be found to decrease the queues and the number of people in shops. All right, let's take a short break. Stay with us. We'll be in conversation with the head of the